Hello students, we'll discuss a instrument which is very commonly used in the day-to-day surgical practice in OP, dressing room and in casualty, emergency room and so on. So identify what this instrument is. See that it is this blade is straight here, there is a knob here. If it is like this, there is a knob here and this front blade is curved and stout. Shorter than this, locks like this, very stout front blade, triangular behind lower blade with a knob which locks very well. So this is like this curved blade. So what this blade is, what this instrument is, it is Lister's bandage scissor. Very typical scissor, which is very stout, which you can cut the dressing. The patient has come with the dressing for change of dressing, earlier dressing bandages to cut, which is very useful because this knob, it's a blunt one, so it won't injure the patient's skin when you pass it in front part. This front part, cut the bandages. Also, it is used to size the bandages. You have to, in the hospital, there is a team to make bandages, dressings and other things. So they use this scissor to cut the bandages so that design the bandage, make the sizes, different sized bandages. So very useful instrument in the casualty, OP, surgical ward for day-to-day surgical work, especially cut the bandage, to size the bandages and so on. This is Lister's. Most of us don't know, remember the name. Lister's bandage scissor it is. So I already told features. This is exactly, it looks same it is. And mainly to cut the dressing and bandages, it is stout and sturdy. Remember, stout and sturdy, it has got upper and lower blade. Circumferential bandage to cut dressings, plasters, and you should also sizing the dressing in the OT side room. So that is the research users, very commonly used, but we don't know the name. Many times we don't remember the name. That's why I put this one to understand, because very common scissor which we use. So students, go through my clinical methods in surgery with the lectures about how to examine a patient. Go through my manual book, details everything. It's all surgical topic. Operative surgery details every operative procedures properly in detail with illustrations. My digital lectures for UGs with the CBM syllabus and basic for the PGs covers everything. I hope you understood this Lister's bandage cutting scissor very well. Thank you very much.